Okay, welcome everybody. I think we will start now. Thank you for joining our session. So we will be focusing on how the ABS partnership is improving early childhoods through improving the diet and nutrition of children and their families. We're going to be taking answers at the end of the session. We have some dedicated Q&A time. So if you want to pop your questions in the chat, we'll make sure we try and answer them at the end. So firstly, I wanted to introduce our speakers today. My name's Angharad Lewis, and I'm the Diet and Nutrition Public Health Officer from Lambeth Early Action Partnership, which will be referred to as LEAP. And I'll pass on to my fellow speakers. So if I could introduce Jill.
Hi, I'm Jill Smith. I'm the Senior Project Officer at Small Steps, Big Changes, Nottingham.
Thank you, Jill. And Vicky.
Morning, everybody. I'm Vicky Morgan. I'm Development Manager at the Centre for Early Child Development, which is part of Blackpool Better Start.
Thank you. And Chloe.
Hi everyone, I'm Chloe, Maternal and Child Health Development Lead here at Better Start Bradford.
Thank you. Okay, so to start off, we want to think about why diet and nutrition matters. And that's because we know that good nutrition during pregnancy and the earliest years of life is vitally important for a child's growth, development and long-term health. It plays an enormous role in child development, impacting cognitive, behavioural and physical development, as well as performance in school and ability to concentrate. We know that childhood overweight and obesity has both immediate and long-term health outcomes. Obese children are much more likely to be ill, absent from school, have health-related limitations and require medical care than children with a healthy weight. Furthermore, nutritional deficiencies in early childhood can result in a range of health issues, including poor oral health, anemia and vitamin D deficiency. Obese children are more likely to become obese adults, leading to even more serious consequences, including cardiovascular disease and type 2 diabetes. So what's the scale of the problem? There's widespread recognition that childhood overweight and obesity is one of the biggest health issues of the 21st century. So latest data from the NHS shows that 10.1% of reception-age children aged 4 to 5 were obese in 2021-22, with a further 12.1% being overweight. And we also know that there's a strong link between children living with obesity and deprivation. During 2021-22, reception-age children in the most deprived areas of England were more than twice as likely to be obese than those in the least deprived areas. And the infographic on the right shows you that by year 6, these numbers have almost doubled. But we know that the causes of obesity and overweight are complex and multifactorial. They're the consequence of an interplay between a wide variety of variables and determinants related to individual biology, eating behaviours and physical activity set within a social, cultural and environmental landscape. Not all families have the same opportunities to make healthy choices. For some, living in poor housing and having a low income can affect their time and capacity to avoid unhealthy food choices and prioritise healthy activities. They also often live in areas where there is a lack of availability of healthy food, and the food on offer is of high fat and sugar content with little fruit and vegetables. And these are the communities that ABS partnerships want to support. All of our work across the 5 sites is guided by and aligns with a variety of national policies which aim to improve the health of children and families. And on this slide, we've just got a few examples. So, for example, the Healthy Child Programme, Pregnancy in the 5 First Years of Life, which is from the Department of Health and Social Care. Health Matters, Giving Every Child the Best Start in Life from Public Health England, PHE. The Best Start in Life, A Vision for the 1001 Critical Days, again from the Department of Health and Social Care. Health Matters, A Whole Systems Approach to Obesity from PHE, and the NH Long-Term Plan. That's just a few of many guiding policies. So as the cost of living crisis deepens, more families are unable to buy enough food. Around 4 in 10 families of children are spending less on their food for their children. A Food Foundation survey conducted in September 2022 found that 1 in 4 households of children experienced food insecurity in the preceding month. The same survey found that food insecurity had increased more in households of children than those without. And they also found that many families who are struggling to afford food are cutting back on buying healthy foods such as fruit and vegetables. In this current context, it is vital that families are supported to access affordable, healthy foods. There is no single solution to tackling such an ingrained and complex problem. A collaborative whole systems approach is needed to promote healthy weight in children, young people and families, rather than single interventions on their own. They need to be tailored to local needs and work across the life course. This includes universal, targeted and specialist services that promote healthy eating. So that's too much to go into now, but on this slide, you can see a graphic from Public Health England, which gives an idea of the types of activities that are successful in promoting healthy weight. And I think what's most important is that evidence suggests that place-based, community-centred approaches to promoting healthy weight in children, young people and families would lead to future health benefits. And this is the model that the ABSIPS partnerships in each site have adopted. So on this slide, we've gathered some of the key outcomes that we are aiming to achieve across their partnership. On the left-hand side, it's about improved diet and nutrition. So this can include aiming for fewer children to be born with high or low birth weight, fewer children having high or low BMI, fewer children having dental decay. We also work around improving parental physical health and nutrition. So this can include improved diet and increased levels of physical activity during pregnancy and beyond. We also support positive parenting, knowledge, skills and behaviours. So this might include more mothers initiating and continuing breastfeeding, improving weaning practices, with more families introducing appropriate food at appropriate times. And lastly, workforce skills and expertise. So this is about improving skills around identifying, supporting children who are overweight or obese. To achieve these outcomes, our partnership provides a really wide range of interventions from pregnancy up until a child's 4th birthday. And we're just going to show you a few examples, but certainly not an exhaustive list. So in pregnancy, we have several services for families. One example is Community Activity Nutrition, the CAN programme at LEAP, which is a service for women with a BMI of 25 and over, which aims to support women to have improved diet and increased levels of physical activity during pregnancy and beyond. It aims for babies to be born with a healthy birth weight and to see a reduction in gestational diabetes. Also in pregnancy, we have antenatal breastfeeding support across the partnership, which is provided in various ways. For example, through the infant feeding leads from the maternity team at Mid and South Essex Hospital in the Better Start Southend site, and Lambeth's breastfeeding peer support service, which is employed by the Breastfeeding Network, and again across the other sites as well. Also in pregnancy, we have developed some non-clinical support. For example, in Bradford, they have doulas who act as professional friends, supporting pregnant women to make positive choices, accompany them to appointments, provide practical support at birth, build positive relationships with other services and offer emotional support. And there's also the Small Steps at Home intensive home visiting programme in Nottingham, which is delivered by a paid peer workforce. So in the postnatal period, we also have non-clinical support. Parents can visit the Blackpool Sling Library, for example, and learn about how to use slings and carriers safely and comfortably, and hire those slings and carriers at a subsidised cost. Across the ABS sites, there's a varied offer of continued infant feeding support, as well as weaning advice. So for example, in Blackpool and Southend, there's an enhanced health visiting service to support improved weaning practices, which aims to help more families to introduce solid food at appropriate times. We also have oral health support. In Lambeth and Nottingham, there are oral health profession teams who provide oral health packs, for example, to families with children under the age of 1. And for older children, we also offer a range of activities. For a specific example, in Nottingham, they provide an early intervention for children where they're growing quicker than expected, which includes a bespoke package of care and also group services. And just a few more, across all of our sites, we have lots of different activities which are designed to support parents and skills and knowledge around healthy eating. So one example is cooking sessions. And lastly, in across Blackpool, Lambeth and Nottingham, a Better Start programmes, we support supervised toothbrushing programmes in early years settings in our communities. So as you can see, we've got a really wide and vast portfolio of interventions which we provide, and this was just a few of them, not all of them. But today, we're going to be focusing on 2 in-depth examples of how we support families. Firstly, around supporting infant feeding choices, and then about supporting families to access healthy food before we highlight some of the impact of our work. So thank you very much, and I'm going to pass on to Jill now, who will be talking to you about infant feeding choices.
Thank you, Angie. So supporting parents with infant feeding choices. If we could go to the next slide. World Health Organization recommends exclusive breastfeeding for 6 months, and that babies continue to receive some breast milk for the first 2 years. Breastfeeding can cut the chances of a child becoming obese by up to 25%. Now, that's a UNICEF piece of information. Breastfeeding can contribute to a reduction in health inequalities, but 80% of parents who finish their feeding journey within the first few weeks tell us that they finished feeding before they wished to. 74% of babies receive any breast milk at birth, which is the latest public health fingertips data from 2016 to 17, but only 46.2% of babies are receiving any breast milk at 6 to 8 weeks. And we know increasing deprivation is associated with decreased breastfeeding initiation. I'm sure this information isn't new to a lot of people in this room, or the confusing narrative that it represents. Next slide. These are some of the things that are happening with national policy. The NHS long-term plan makes the commitment that all maternity services that do not deliver an accredited evidence-based infant feeding programme, such as Baby Friendly, will begin that process by 2019 to 2020. Breastfeeding continues to be a high impact area within the health visitor delivery model. And most recently, Family Hubs are providing 50 million to establish infant feeding support services. They're essential and go further. Infant feeding activity will deliver a multi-component integrated strategy. Next slide. So what supports breastfeeding? Evidence tells us effective support should be offered as standard by trained personnel during antenatal or postnatal care. It should be ongoing, tailored to the setting and the needs of the population, which sounds very much like a Better Start approach. Peer supporters, lay professionals or healthcare professionals can offer this support either alone or in combination. Strategies that rely mainly on face-to-face support are more likely to succeed. Breastfeeding support is a key part of ABS offer across all of our sites. Antenatal education. The Southend one-to-one service offers antenatal support and education. This service offers postnatal home visits and provides support on the ward in Southend Hospital. Baby Steps antenatal classes in Blackpool and the Small Steps at Home peer support service in Nottingham also offer education opportunities. Support isn't always delivered by a healthcare professional. Well-trained peer supporters, such as those for the Breastfeeding Network supporting families in Lambeth, deliver effective and valuable support. So support can be in a one-to-one session or a group, such as those delivered in Southend and Bradford. But breastfeeding isn't a decision that's made in isolation. Support from partners and community can affect initiation and continuation. You can see this in the inclusion of breastfeeding information in the SSBC Dad's Pack resource. The wider community is important. All sites offer evidence-based information and normalise baby behaviours. Holding Time Bradford, as pictured here, uses creativity to overcome cultural barriers beautifully and support a more breastfeeding friendly environment. SSBC commissioned a bespoke breast and chest feeding public health campaign for Nottingham City. This was co-produced with local residents and featured a well-attended stakeholder group with midwives, infant feeding leads, health visitors, peer supporters and families meeting regularly and contributing their views on the campaign. It was co-produced through 6 months of market research, including the Big Nottingham Breastfeeding Survey, a county-wide survey with 1,800 respondents, focus groups and creative testing. To look at co-production more closely, what did parents tell us? Unrealistic expectations of breastfeeding were not helpful. They didn't feel prepared for the realities of breastfeeding. Health messages were not working and felt controlling. That's a message that came through really strongly. Feeding in public was a concern for many parents, and partners wanted to know how they could support breastfeeding. Many women said that they would have breastfed for longer if they had had more support, felt more confident to do so, and if the public perception of breastfeeding was better, and mentioned if they had had more information about the challenges of breastfeeding, they would have felt better prepared for them. Women and parents who did breastfeed for longer identified autonomy, it's my choice, feelings of connectedness to their baby, and an awareness of the potential challenges as the main facilitators. Those themes were woven throughout the campaign. Feed Your Way launched in October 22 with out-of-home advertising, paid social media, Google ads and community-based pop-up events. The campaign heroes local people who share their stories and represent some of the themes that we've discussed here. Meet Eleanor and Ian.
Hi, I'm Elle.
I'm Ian.
And we live in Sherwood in Nottingham. And we have 3 daughters, Chloe who's 4, and twin girls, Naomi and Abigail, who are 22 months. I had quite a traumatic birth with my first daughter. So breastfeeding gave me an opportunity to really bond with her. And in the end, I managed to breastfeed until she was 19 months. It was challenging as she had tongue tie. I even almost stopped from the pain. But thankfully, with the help of my partner and healthcare professionals, we got through that and I was able to carry on. When I got pregnant with my twins, not many people thought I'd be able to breastfeed, but I knew I at least wanted to give it a go. We've been through pretty much everything in our journey, but 22 months in, we're all still going. Again this time, my partner has been my biggest support.
Breastfeeding comes with its many challenges, and breastfeeding twins is an entire different story. As she was focusing on that, I helped in any way I could, whether that be doing some research for her, but also helping with our eldest. I've taken over cooking, for example. I often say to her, you feed them, so I feed you. I just try and encourage her to be present as much as I can, especially through the tough feeds, and she knows I've got her back, whatever she wants to do.
Breastfeeding is definitely not just between the person feeding and the child. There are many ways that the people around you can help make it a smoother journey, just with a smile sometimes. And I've learnt to politely shut down those who don't, as it's normal at the end of the day. I feed my way, feed your way. Visit the website today. Hi, I'm Elle.
I'm Ian.
So Feed Your Way, as you saw there, is accessible as a website and on social media. Branded digital materials were available for the workforce to download and share. And there's several other videos of local families that you can watch there. What happens next? Feed Your Way is built on co-production. Phase 1 is a conversation with families and to some extent the communities around them. Further phases will include conversations with businesses, highlighting the value of supporting breastfeeding families both as customers and employees. This will be facilitated by a refreshed stakeholder group. We'll be engaging with business networks, as Carla shared earlier in the panel, as well as public sector partners to inform this discussion. Feed Your Way already has a body of research to interrogate, the Big Nottingham Breastfeeding Survey. We'll revisit this research and explore what business owners and employers have shared with us. We won't forget the voice of parents, and we'll look again at the thoughts and experiences people have shared with us about breast and chest feeding in public spaces. Feed Your Way began with an ambition to engage everybody on the topic of breastfeeding, not just with a breastfeeding parent, but with employers, communities, family, and wider society. This conversation needs multiple perspectives. We will expand our assets portfolio to create new images and assets and tools that speak to a wider audience, specifically employers and businesses in the city. The majority of babies in the UK receive infant formula milk. Mixed and combi feeding is part of the breastfeeding journey, as is expressing and offering breast milk in a bottle. Our research told us that an all or nothing attitude was not helpful. All parents deserve evidence-based information about how to feed their baby. Support should be offered without bias to ensure safe and responsive feeding. The inclusion of responsive bottle feeding information within Feed Your Way can support parents to follow their baby's feeding cues and avoid overfeeding. As the cost of living crisis deepens, information about infant milk, free from promotional claims, is vital. On that note, I will hand you over to Vicky from Blackpool to talk about supporting families to access healthy food during the cost of living crisis.
Hi, good afternoon, everybody. I'm going to be talking to you about families accessing the NHS Healthy Start scheme. But before I do that, I'd like you to grab your smartphones, please, because there's going to be a couple of polls to help us understand a little bit more about your experiences with the Healthy Start scheme. On the next slide, it's really simple. You just need to scan the QR code and that will allow you to answer some of the questions, and we'll be able to see what the audience's experience and views on the Healthy Start scheme is. You can start with question number 1 if you're already set up and ready. What can you use Healthy Start for? Is it fruit, vegetables, milk and formula milk and baby food, or general shopping? And as you're answering the questions, I'd just like you to make a mental note of what your answers are, because they will be answered in the video that we'll be showing later on, and in some of the commentary as well. So really interested in number 2. People are quite confident that it's fruit, vegetables, milk and formula milk, which it absolutely is. Really nice reminder for people that are helping parents is that that also includes frozen and tinned fruit and vegetables as well. Question number 2. How do families pay for the goods? Is it using vouchers with the cashier, using a prepaid MasterCard, or using a prepaid MasterCard including online? Oh, we're getting a bit of an even split on this one. And this actually will highlight some of the commentary that I'll deliver shortly. The scheme is actually now using a prepaid MasterCard. It can be used in any store or marketplace, or even community pantry that accepts the MasterCard symbol. It can't be used online, and the voucher scheme was actually disestablished in March 2022, and we'll talk a little bit more about that in a minute. And lastly, question 3. Thank you for everyone that's giving this a go and adding some interaction into our presentation. How much do parents receive per week? Is it £4.25, £4.25 or £8.50, or none of the above? Give you a couple more seconds to get your answers in there. Again, we'll highlight the answers shortly. Maybe a bit of a trick question this. So the answer to this question is £8.50 in the first year of the baby's life, and £4.20 after that up to the age of 4, and £4.20 while somebody is pregnant. I guess the answer is actually could be none of the above, because if you've got more than one child, it means that you'll be able to access the money for each of those children. So if you've got 2 and 3 children, actually it can be quite an amount that can go towards accessing fruit, veg, milk and formula milk as well. So the Healthy Start scheme just the next slide please, is a benefit to support families who are pregnant or who have children under the age of 4 to get additional fruit, vegetables, cow's milk and formula milk alongside vitamins. At this current time, it's more important than ever that we maximise income for families. When we hear of people choosing between eating or heating, and if families are eligible for Healthy Start, it's just another way to maximise the family's budget during this cost of living period. As mentioned, the scheme is now via a prepaid MasterCard, and during the transition from the voucher scheme to the card scheme, we noted locally and from our colleagues nationally too, that a number of parents were having difficulties having to reapply for the scheme, even though they'd been accepted previously. In Blackpool, we worked alongside health professionals such as our health visitors, midwives, and using our community connectors to ensure that families got practical support to be able to apply. During the keynote, it was really interesting that one of the questions that came to Kate Silverton and answered by Claire Law, our director, was about how we might have been able to do this. How have we supported parents during this particular time? And I'm hoping that the rest of this presentation and some of the video content might be able to explore that a little bit further. The workforce element to the project was twinned with a robust communications campaign, sharing how families sign up and what they can use the money for. This was shared with partners on our social media channels and website, where we have got a dedicated cost of living webpage too. When we finish with the presentation, we're going to pop all of these links in the chat, and we're happy for any listeners today to share the content with their communities. From today, it'd be great that we can support access in other areas. But first of all, here's the information from one of our own money saving connectors.
Did you know, if you're more than 10 weeks pregnant or have a child under 4, you may be eligible for the Healthy Start scheme. It's worth £34 a month for the first year of your baby's life and £17 a month per child aged between 1 and 4. If you're on certain benefits or if you're under 18 and pregnant, you can apply for the NHS Healthy Start prepaid card to use towards your weekly shop. You can use it to buy fruit, veg, cow's milk, infant formula and other healthy foods in any shop or market that accepts MasterCard. So we put together a little video to help you understand the scheme, eligibility and give tips on completing an application. And our friendly community connectors are always here to help you lighten the load. So if you need any support, please do get in touch. To apply, you'll need your name, address, date of birth, national insurance number, baby's due date if you are pregnant, and a benefit award letter if you are over 18. You must make sure the details you are entering are exactly how they appear on your benefits claim letter. Otherwise, the system won't be able to find you and this may delay your application. For example, if you are listed as Victoria on your claims letter, the system won't be able to find you if you apply as Vicky. Free vitamins are for pregnant and breastfeeding women and children from birth to 4 years old. Here in Blackpool, the main distribution point is via our Better Start connectors. Check our community connector page for our whereabouts for each week, or get in touch if you would like a friendly chat.
And the full video that's around 6 minutes long is available on our website, and it will give parents and professionals that step-by-step guide in how they can support parents to access the scheme. So in addition to the family-facing offer and communication strategy, we've also been working with our partnership to lobby for accurate and timely data to target any further efforts. This is the first uptake data that's been published since the start of the MasterCard scheme. And as you can see, our campaign has resulted in a 10% increase, and now one of the highest uptakes in England. The success has given Blackpool a number of opportunities to share good practice via articles and blogs from organisations such as Sustain, and we'll put links into the chat for those as well, and discussing the campaign via news outlets and the radio. In the chat, I'll add a link for the England data and for also the other nations, so you can check the uptake percentage for your local authority. Before I hand over to Chloe from Better Start Bradford, please start putting questions in the chat for our Q&A or thinking about them before we close. Thank you.
Thanks, Vicky. I will be talking about our Henry offer in the 3 Better Start Bradford wards and how we are using learning from this to improve the Henry offer across the wider district. Henry is a national programme which delivers intervention to improve nutrition, emotional well-being, parenting skills, breastfeeding and activity levels directly to families as well as professionals. Henry provides a wide range of support for families from pregnancy to age 12, including workshops, programmes, resources and online help, as well as working with NHS trusts, local authorities and wider partners to ensure that preventative measures are adopted to reduce rates of tooth decay, obesity and associated diseases. Better Start Bradford currently commissions Henry to deliver the Healthy Families programme, an 8-week intervention for parents and carers of babies and young children to support the whole family to develop healthier ways of living. Next slide, please. The current Henry Healthy Family programme consists of an offer of 8 sessions delivered either in a group or one-to-one setting. More than 440 families have completed the programme to date, and all of those parents and caregivers who have completed the Henry programme questionnaires in our end of contract reports said the programme was either good or great. More than 90% would definitely recommend it to other families. Alongside the Healthy Families programme, we also offer starting solids workshops and cooking for a better start, which gives families the skills and knowledge they need to cook straightforward, healthy food at home. It has been designed to use a minimum of equipment and for each meal to be cost effective. Next slide, please. We already have evidence to suggest how Henry helps families coming from the existing Henry National Evaluation Studies in 2014 and 2016, as well as the Henry Lasting Impact Report. Our evaluation by the Better Start Bradford Innovation Hub found families describe significant improvements in parent confidence, their ability to set boundaries, particularly at meal times and snack times, around TV and computer games, active play and bedtimes. Parents described having more times for themselves. They described that they felt more supported, had increased happiness levels, and they described feeling less isolated. The intervention improved how often families sat down together for a meal, and families reported a reduction in how often the TV was on at meal times. We are now going to share a short video about the Henry programme in Bradford.
I wanted to do the Henry programme because I wanted my son Hamza to have a good relation to food, all sorts of food. I want him to eat healthy food. And also I want to have a good relation to portion size as well, which is difficult for myself, so I want to have the right start. The main thing I learned was actually not treating food as a treat, not giving it to them as a reward. So just food needs to be food. They can have sugary food, but in very small portions and not as a treat. And also I learned actually that it's good, or that it's okay to have some me time, which I didn't before it was right as a new mummy.
My top tip to give to families to improve their health and nutrition is just to embrace all the small changes that they can into their lifestyles and just to be as active as they can.
Many parents find our Henry Group programmes a life-changing experience for themselves and their family.
Better Start Bradford are currently supporting Henry to embed their service offer within the Start for Life Family Hubs model. Currently, the district-wide offer for Henry is small and struggles to receive enough referrals to run a successful programme. In order to do this, we are using the EAST framework, which considers how making an intervention easy, timely, social and attractive can encourage behaviour change, and sharing this information to improve the service offer across the wider district. Our learning to date suggests in order to make it easy, it's important to use locations families are already attending at a time that they can get there. Locations that are alongside a childcare provision or at a school with good transport links had higher uptake, particularly in school term time. We also found it was really important to make the referral process as easy as possible and include the option for self-referral. In order to make the intervention attractive, it was really important to use simple, attractive communications, which highlight the benefits of attending, such as improved parent confidence, time for themselves, and easier boundary setting. We needed to ensure that families were aware that the intervention is not only free, but will also provide them with information on how to eat well for less in the current cost of living crisis. We found that coming out of COVID, parents really felt the benefit of an offer of a face-to-face programme, and these were really popular due to the social elements that they provide. We encourage attendees to share information with their peers about the service, and the recruitment of a community partnerships officer meant that families often made a direct commitment with a referrer to attend the programme. It was really important to make the intervention timely, so to prompt people to attend when they were most receptive, for example, following a starting solids workshop or after the 8 to 9 month and 2 to 2.5 year health visitor reviews when nursery funding starts. We also found that text message reminders were really helpful with this process. I will now hand back to Angie, who will be looking at our wider programme impact and implications.
Thank you, Chloe. And thank you everyone for listening to our session. Before we come to a close, we just wanted to give a little bit of time to think about the impact and our call to action next. So please take a few moments just to read the powerful feedback from parents and carers who have shared their feedback with us, telling us how important these services have been to them and the impact it has made on them and their families. I'll just give you a few moments. So I think what we have really learned today is that what happens in pregnancy and the earliest years of life has a really significant impact on immediate and later outcomes for children. Prevention must include a focus in this area to maximise the chances of improving outcomes across the life course. Early childhood development is a critical period, and preventative interventions and approaches have a vital role to play. Intervening early can also contribute to significant cost savings across a range of areas, including health and education. It is an absolutely crucial time to focus on this area as families have continued to face the fallout from the COVID-19 pandemic and the current cost of living crisis. So I think really our call to action is that we need to address the UK's low breastfeeding rates together, creating a supportive, enabling environment for breastfeeding. Infant feeding education is paramount, and timely interventions for those offering advice to families should have accurate and unbiased information. And we need a collaborative whole systems approach needed to promote the healthy weight in children. So I think that draws our session to an end, and we'll have some time now for questions and answers.
Brilliant. Thank you to the panel, Vicky, Chloe, Angie and Jill, for that really interesting presentation and insights into all sorts of different aspects of diet and nutrition in the early years. It was really terrific. We've just got a few minutes now before we rejoin the main session to have a few questions. So please do pop them in the chat if you've got anything that you want the panel to answer. One of the comments I've had so far from the chat has been around the uptake of the Healthy Start payments, and just wondered if colleagues from Blackpool could summarise their top tips for increasing uptake. You're on mute, Vicky.
I thought I would have got away with that. No. Thanks for the question, Dee. I think the answer is probably threefold, really. First of all, if you've got capacity to just speak to the community and gain an understanding of you know, have they applied? If they have, what trouble did they get? If they haven't, why haven't they applied? Because I think, as we said kind of during the keynote, what we want to do with any support for families in this kind of current climate is that we're not having a judgmental approach. So we're not making any assumption that because somebody is working or isn't working, they might not be able to access anything. So that support does need to be done on an individual basis. I think secondly, it's having really good partnerships with your workforce. One of the things that we noted was that our fantastic health visiting and midwifery colleagues, and including staff within the family hubs, knew about the Healthy Start scheme, and they had known about it for some time. I think they were under an assumption that because they were telling parents about it, that it was quite easy for parents to apply. And one of the things that we've done through our community connectors is actually been able to spend time with parents in community spaces, using tablets if people experience digital poverty and things like that, to support them with the application. A couple of nuances were shared in the video just before, that if we're putting shortened versions of our name, for example, on the form, the computer doesn't recognise it and you get an automatic decline. So all of these little bits of information can be quite important. And then I think lastly, it's about thinking about who else might be interested in this. So, and I think it was really interesting when someone shared before about how we can look at the narrative of breastfeeding through a climate change approach. I think when we're looking at income spend through families, we can also work with local grocers, market stalls, providers, who they can share the commentary around uptake through Healthy Start, because they might be able to get increased income. And when we looked at this locally in Blackpool, before we'd increased our access to Healthy Start, we realised that the town was losing just under £200,000 worth of spend per year from families who weren't accessing this scheme. So you might be able to get other organisations and professionals that are working in different departments to also help lobby and share messages, because it might be an interest for them.
Brilliant, thanks Vicky. Moving on to the next question, Kate has just raised the following. It's around Henry, so this one's for you, Chloe. How are families prioritised following their health and development reviews through the Healthy Child programme for schemes like Henry? Are there criteria for streaming some parents and families into that programme?
We have been in a really fortunate position whilst Better Start Bradford has been running, in that anybody who lives in the Better Start area is eligible to join the Henry programme. So parents and their children don't need to meet a specific criteria. There is work ongoing between our Better Start Henry team and the wider district Henry team to ensure that any referrals that come to us within the Better Start area that are not applicable because the family doesn't live within our 3 wards are then shared with the wider district so that they can pick them up and also offer them Henry. So Henry is pitched as a universal service, which means that there isn't a specific criteria that families need to meet.
Brilliant, thanks for that, Chloe. I just got one question here. Jill, did you say you have a breastfeeding welcome scheme in place, or are you looking at it? If you've not joined a national one, e.g. the NCT programme, why would this be? We're debating between our own and that one.
Yeah, I think Dee's got a lot of great questions about this today. We are developing our own breastfeeding welcome scheme. We will seek advice from the major partners, but at the moment we're looking for something that's tailored to Nottingham, that goes beyond the stickering system that we want. So we're looking for a breastfeeding welcome scheme that gets involved in looking at training for workforce, understanding the role of an employer in supporting infant feeding of their staff, and looking at some digital online resources that can be used to support that as well. So we want to go above and beyond to make our breastfeeding welcome scheme something that's sustainable and lives on after the Better Start sites have finished their term.
Great, thanks, Jill. I haven't got any more questions in the chat. There was just one quick one to answer. The Feed Your Way video was really well received, and the case study it provided. And there was just a question about whether that could potentially be used in other areas as part of their own programs. So that's something for you again, Jill, to think about.
Yes, is the short answer, provided they're not adapted or altered in any way. I'm reading the message from my comms team here. Providing they're not adapted, altered in any way, and they reference Feed Your Way with the links, etc. We do have some brand guidelines that I can share if people are happy to contact me outside of this session. Feed Your Way's strength comes from our conversation with local people and representing their stories and their experiences. So you're welcome, you know, people are welcome to use them, but I would always ask to consider, is this relevant to your location and what people there are telling you?
Brilliant, thank you. Jill, did you just want to come back to that comment around?
Yeah, absolutely. So messages about breastfeeding in antenatal education. I think if we understand what a normal breastfeeding, I hesitate to use the word normal, but what new baby behaviour looks like, how many feeds you can expect in a day, at what time those feeds might be, people will then be reassured as to their baby's feeding pattern. So it's that education is about a very realistic expectation of what new baby behavior looks like, how often they may feed and how often that can look for, and some understanding around things like cluster feeding, which aren't necessarily a sign that your baby is not getting enough milk. So there's obviously a need for appropriate support so that issues can be picked up and dealt with when they progress, but also understanding what that might look like on a normal day. And the all or nothing is not helpful. I think there was some parents who felt that messages they got told them that if they wanted to introduce formula feeding to support their choices, that was the end of breastfeeding. And actually a conversation with them about how to maintain their supply alongside using formula or offering express milk would have continued their breastfeeding journey. I hope that helps. They're really big questions.
Brilliant, thanks, Jill. And you'll see that Dee's just put in a chat the email for you to contact her to follow up after this. Thank you very much.
Thank you.
I think we're coming to an end now. We've only got a couple more minutes before this room closes automatically and you get moved back into the main meeting area. Just wanted to say thank you again to the panel and also highlight that the chat that has taken place and the presentations that have taken place today will be written up into a report that will be available after the event. So you'll be able to check the information contained there if there's something you missed or you need clarifying. And I think that's about it. If you want to leave the room now, you can, but don't leave the meeting overall, otherwise you'll have problems rejoining. Thank you.